It is really sad and heartbreaking to see a rapid rise in the number of corona cases or COVID-19, particularly in India, where the situation has become bad to worse. People are running from pillar to posts, asking desperately for the help that they badly need. There's lack of beds in hospitals, there's lack of essential supply of medicines. People are dying fighting for their last breath without oxygen. In the recent days, you may have heard of the double mutation that the virus already had, meaning thereby the virus has already become even more powerful than before. It is now not sparing even the young adults and children. The situation has become bad to worse. Now, for a long time, we have been hearing about maintaining that 6 feet physical distance, washing our hands frequently, and wearing the mask. All the way politicians and celebrities have also been talking about that thali and tali. But today I am going to speak on two aspects. Number one, that please use your intellect wisely. Do not be a victim of falsehood and false information that have been circulating mainly in the social media. Please seek advice from the right person. Please seek advice from the healthcare professionals who have a knowledge of COVID-19 and its management. Very recently, I have seen Corona kit being sold in the markets of India. This contains medicines of which the patients have got no knowledge of. Let me tell you that some of these medicines are not going to be useful at all in preventing the severity of the disease, but on the contrary, it's going to be harmful for some of you. So please refrain from the medicines which are not essential for you. Please take or seek advice from a healthcare professional. It has also been seen that people are running after medicines like remdesivir, dexamethasone, ivermectin, and so on. And people have got absolutely no clue or idea as to why they need these medicines and what are they for. So please seek advice from doctors who have got the experience of using these medicines. And I must tell you that these are not magic bullets. These are not the medicines that they are going to decrease the severity of the disease or they can prevent death from COVID-19. You may be unnecessarily wasting your money on these medicines which can, on the contrary, be harmful for you. The second and the most important aspect of what I am going to talk about is the vaccine. During this crisis, only one thing that can help you to decrease the severity of the COVID-19 disease or death is the vaccine. Vaccine has been the most important discovery of the century for mankind in preventive medicine. Yes, the most important discovery of mankind in preventive medicine for this century is vaccine. And mind you, vaccine is to help you, to protect you, and not to cause you side effects. I get to hear from patients, my family members, and even some friends who are afraid, who have got this notion of apprehension, who are skeptical, and majority are confused whether they should get vaccinated against COVID-19 or not. Now let me tell you that COVID-19 vaccine is for your safety. It has not been developed to cause you harm. It is going to help to decrease the severity of the disease, and it is also going to protect you from death. Now many tell me that the vaccines have got these side effects, that side effects. But remember, these are not the side effects, these are the immune reactions. Very recently, I completed both the jabs of vaccine of COVID-19 along with my eligible family members. Now, I'm sure some of you may be thinking whether I got some symptoms or side effects or not. Yes, I was a bit feverish, I had a bit of dull headache, I felt fatigued, but only for 48 hours. And mind you, these were not side effects, these were how my body reacted to the vaccine and how my immunity reacted to the vaccine. In other words, it is your immune system that is going to fight in that manner if you are attacked by the actual virus. So it is an immune reaction, it is not a side effect. So please do not be afraid of the side effects of the vaccine. Please go ahead and get yourself vaccinated as soon as possible. I get phone calls from relatives, friends, and patients that, well, I have got heart disease, I have got high blood pressure, diabetes, I have got lung disease, kidney disease, and so on. Should I go ahead with the vaccine or not? And my answer is that you should be the first one to take the vaccine. You should be the first in the row to get yourself vaccinated. Because God forbidden, if you have COVID-19, then the severity of disease is going to be worse and you are likely to deteriorate much faster than the people who are healthy and who do not have these comorbidities or illnesses. So please bear in mind that vaccine is going to protect you, it's going to save you, it is going to decrease the severity of the disease if God forbidden you have COVID-19, and it is also going to prevent death. Now, this has been shown by a lot of trials that have been done on tens and thousands of patients that the vaccines have got efficacy and they are entirely safe. Now, some of you may have heard about the blood clots that has occurred from few vaccines, couple of vaccines, Johnson & Johnson and AstraZeneca vaccine. But let me tell you, these were the complications that were seen during the trial, which has been conducted on thousands of patients, and this is extremely rare complication. Just to show you the example, have a look on the screen here. So once again, it is my appeal that during this hour of crisis, the only thing that is going to save you, the only thing that is going to protect you is the vaccine. So please get yourself vaccinated ASAP.